You want to know how to get rid of that loose skin under your chin? Let's go. First things first, we are not going to do kybella cool sculpting or exercises. Like, what is even, what? No. Because there's one organ in your body that you cannot exercise, especially with these mouth exercises. It's your skin. You cannot exercise your skin. So then what are your options then, right? You either got two. You've got minimally invasive or you've got invasive. Let's figure out which one's right for you. If you've lost some weight recently and you're in your 20s, maybe early 30s, right? Then you may have just a little bit of loose skin. Well, that's when probably minimally invasive is going to be a good option for you. Things like RF microneedling. Although it does a little bit of tightening, I really think of RF microneedling as more of a preventative kind of treatment, kind of getting some longevity out of your skin. Tightening, it does some of that, but it's not the best option. Then you can go for things like a little bit more minimally invasive. Things like maybe J-plasma, where we make a little incision and we run a little device underneath the skin. The other devices are like Skin Tight, those kind of things, Face Tight. Those will help tighten up some of that skin around that region. So that might be some of your better options for the more minimally invasive approach. But then we've got some of you guys that are like in your mid-30s, maybe to mid-40s. You've got, maybe some of you have some like still really good skin. Others of you, your skin's on the way out, depending on your genetics, right? So if you are still wanting to get rid of some of that loose skin, maybe you just need it kind of brought up a little bit. Well, then there's still some good options for you. They're still minimally invasive. There's a procedure called MyElevate where we actually run a thread back up behind the ear, loop it all the way around, pull it up and tighten it up. And that lifts all of this up. Stop staring at my double chin. Then it brings all this up and in. Now, you can combine that with J-plasma and that will snatch everything in as well. That definitely helps. But then there's those of you, like me, who are kind of getting close to 50. Did I just age myself? See, but as you get older, your skin does not snap back as well. You can do all the treatments that you want in the world to try and tighten it up a little bit more. And yeah, it may work, but it's not going to work as well as it did back when you were in your 20s and early 30s. So now what do? Well, now you've got a lot more things going on. You probably got some muscle separation, right? These two muscles here in the neck stretch. So that brings all this down. Well, now that needs to be tightened back up. Also, a lot of this starts to descend, so that needs to be tightened up too. And then you've got some extra skin. We could even tighten up all those muscles, but you still got some extra skin. Well, what do you do then? Well, unfortunately then, you have to get rid of that. You have to cut that out. There's a couple ways to do that. Now, if you don't have a ton of extra skin that you need to get rid of, let's say, maybe my age, you're in your mid-40s or so, right? You've just got a little bit extra here. It's still got some snap back, right? We can do a little incision starting right here at the bottom of the earlobe, bring that up back behind the ear, maybe even go into the hairline if we need to get rid of a lot. And then we can bring that up and back in here, all right? Now, if you have a lot, a ton of extra skin, right? You've lost a ton of weight, your skin has no elasticity back to it, well then we may need to do the incisions kind of right in front of the ear, extending back behind the ear, and do a full face or neck lift. So there you have it. Minimally invasive for younger people, the whippersnappers. For those of us kind of getting a little older, sorry, it's gonna have to be some sort of surgical intervention. And just remember this, friends don't let friends get kybella. Dead serious.